This season of the Good Up podcast is sponsored by Empath Psychological Services. Good Up is our space to talk about those experiences in life we didn't know we all had in common. We're the after work happy hour conversation with your best friend.
You good up vibe, like, hello.
The place where you bring up the hard parts of life, the ones that made you laugh, and the things that made you who you are. Because who said becoming good up wasn't a little bit uncomfortable? Stay tuned for more information about this week's episode.
Here at the Good Up Pod, we're all about shedding light on life experiences that have contributed to who we are and learning to navigate them to find a feeling that's, good up.
For some of us, that journey includes therapy. Empath Psychological Services operates with the belief that life's challenges are not all of who we are.
They aim to create a non-judgmental environment to help their clients harness their own power and to find their path to mental well-being. Good Up and Empath Psychological Services share a passion for helping others navigate their own healing their way.
If you're interested in teletherapy services in the U.S. Virgin Islands or the state of Texas, check out the link in the description box for more information on how you can book a session with Empath Psychological Services. Hey, beautiful people, and welcome back to another episode of the Good Up podcast. It's me, your girl, Venus's number one hater in this period of time. Yeah, I hate her right now. Maybe she don't deserve it, but that's where I am. But welcome to the people. And what's your name this week, Deidre?
Honey, I'm Paul Randolph this week from Jenny and Georgia. Last week I was Georgia Miller, and this week I'm Paul Randolph because
Is he the fine Indian or South Asian?
Oh no, he was fine. First of all, every man on that show who wanted Georgia was fine. I will get, even there was times on the show where other characters, every time they met one of her exes, they're like, where do you find these men? Georgia, they'll be pulling the finest men.
I ain't even I haven't watched that much of the show, but she is that girl.
That man is very much deserving of the my man kind of treatment. Cause one thing about he don't play about his bitch, okay? Anybody could get behind his fucking woman, okay?
And that's who Deidre is this week, ladies and gentlemen.
I am Paul Randolph this week, okay?
So welcome to the Good Up podcast. I'm so excited for today's episode. I just say that every week, but I legit excited for today's episode. So we have somebody here who it's a long overdue for her to be on the podcast, and We're talking about a subject that is near and dear, I think, to most of our audience's heart, because our audience consists of mostly Black women. So if you're a Black man and you don't listen to the podcast,
listen up.
You don't get a hall pass for this. You need to listen. If you are a white person and you listen to this podcast, you don't get a hall pass. This episode is actually for you. It's about most of our audience, but it's for you. So you can listen and pay attention and learn whatever the fuck you need to learn. Okay? With that being said, we have Doctah. It's Doctah, okay? Brittany Dawson on the podcast today. So I am going to pass it over to Brittany so she can introduce herself and tell the people all of the good up things about herself. So
hi. No, I want to say first, let me say I've been fangirling. I feel so excited. And you gotta say it with an accent, because we gonna whitewash it for the episode. But I'm really, really excited. I am Dr. Brittany Dawson. You guys said a doctor with an accent, so it don't count.
Doctor.
You guys said doctor. I am a Virgin Islander first and foremost. I'm a Black woman before anything else. I am a doctor of nursing. I am a midwife and a nurse practitioner by trade. So I hold my doctorate degree because I want to write policy and do all those fun things. But I function in women's health mostly and midwifery mostly as my passions. And I've been able to bring that passion home to St. Croix. So I am a provider in St. Croix. I'm launching my practice slowly but surely. I work full-time at the hospital. I am a fellow candidate for my national recognizing organization. I am vice chair of the Virgin Islands Board of Nurse Licensure. And the list goes on and on and on. But I think my biggest accolade is, I'm very much so happy to be here. I currently practice out in partnership with Her Care. So I am a provider at Her Care, but Dr. Berkeley is the founding physician of that practice. and has been very supportive on me, building and really branching out into the community to build out like what my vision will be for, what I want to see happen here. So it's been a long time overdue. When I tell you, I was so happy to be invited. I really am very seriously was very excited to be invited because I've done a couple other podcasts and I'm like, the man don't want me? Like, you don't want me?
It's never that. It's never that. Please no. Like, we want you mad.
And the other thing is, especially when we have members of our community who do such important work, it makes sense to have you guys on to talk about something that is meaningful and beneficial to the community. And we ain't gonna have you on, Brittany, and you just like talking about like Monstera leaves or talking people business. Like, no, if we're gonna
if you want to do that, we could do that.
Obviously, I would love you on to talk some talk about some ratchet shit. But when I think about the amount of work you do and how valuable your time is, if you're gonna be on this show, if you're gonna take time out of your busy existence to be here, it has to be meaningful. Okay, we ain't gonna have you here on no bullshit.
I see. The thing is that like I believe in duality. I'm with the bullshit. I'm with the ratchet, but I'm also very much so like you're gonna call me Doctah Dawson when necessary. But at the same time, like I'm just as much Brittany. I'm just as much one of the home girls.
That's a fact. Yeah. And I'm gonna tell y'all something, Brittany. Because me and Brittany go way back. Brittany, they'll be on her shit, okay? When I got some real trifling shit I need to work through, me and Brittany be on that phone for hours. Speaking of which, I got an update for you, girl.
When I tell you about my update,
I love this because I know this is a 4-hour conversation waiting to happen.
Legit. Me and Brittany to be on the phone for hours.
Anytime Deidre tell me she got an update for me, I'll be like, all right, let me clear up the rest of my afternoon.
We're going to sit on. Like when you're in high school, you put your feet up on the wall and you're in your bed.
And we be bouncing back and forth. Yeah, it'd be a mess.
I feel like having a conversation should be like, even when you're talking to your providers and talking to whoever, it should be like talking to one of your homegirls, really and truly, because you should get to a place where like you should be able to talk about anything. Like you walk into the office, if you're worried about like a bump on the left side of your vagina, you should be there like, listen, I have this bump. Look at this thing for me, or whatever it can be. Like, because that's why I say like it's one of the coolest things is working here in the community, because people become so comfortable because they know you from high school, like they know you from so and so, or they see you, and it's a really different setting than when I worked in the States. When I worked in the States, I never saw my patients again. Like I would see them once, and I wouldn't see them for years. Like me gonna run into nobody in the street. I'm not gonna deliver somebody's baby and be able to see this baby again. Here, I'm practicing going into the middle of my third year, and I have people that I'm birthing their second babies, and I have patients that I've been seeing for every single year, and I'm like, this is completely
it feels
different.
Good. I'm glad to hear you say that, because that's something that I've been struggling with here is my initial CNM, who I used to see when I lived in a different town, we kind of had that rapport. But then when I moved to where I live now, I've had the same doctor for a couple years, and I just don't feel that connection. And I found myself wondering, is it me? Like, am I expecting too much of my providers? But what you just described is what I want in a provider. Like, you literally all up in my coochie. Like, I want us to have some kind of a rapport.
Like, I need to feel the way about you that I feel about my wax lady. Like, I know that girl.
My wax girl, my esthetician, she knows my business. Me and she'll be talking. She'll be like, you quit that job yet? Like, we'd be running bam, But I haven't had that yet with like my women's health practitioners, and it's like the last time I saw them, like sometimes I feel judged by them, other times I feel like they just want me to come in, get the service and leave, like and I'm like, maybe I'm just like being unrealistic and expecting too much, but now you're confirming like, no, like we should have that. So now I'm finna look for a new one.
Yeah, it's like finding a good coochie doctor is like dating. Like you need to date around. Find you one you like, and make sure they like you back. Like,
can I name this episode the coochie doctor?
Please do. You know, and I'm glad you said that, Britt, because I remember you was on a radio some time ago, and you said coochie doctor, and they told you that it was improper, and I was very offended. And I remember watching that clip, and this was a long time ago, and I remember saying, when Brittany come on a good up pod, we're gonna let she say coochie as many times as she want. Because absolutely not. Like, what the fuck? I was so mad.
And I think I said pum a lot, but it's because like I just like those words. Like I'm a cunt kind of girl. I love a good pum pum. And Brigitte, at the same time, every time we end up on some podcast or something together, I either say pum pum like 3 times, and she'll be like, "Pum pum is your favorite word," and I'm like, but it is.
It's such a good. Deidre, you see the keychain I sent you earlier on Instagram?
I haven't seen it yet. I have to go look.
It's a big pum pum energy, and I was like, I want this keychain. I want this keychain. But
that's my first product launch. I'm gonna launch a big pum pum.
Oh, we need a line of keychains that just like keep the pum pum running, big coochie, and all the shit. Like I would support it, but you could absolutely say coochie on the Good Up podcast, because one thing we don't have is fucking breath up. See, we gonna say what the fuck we want on here. So with that being said, though, you kind of hinted at it a little bit with like your experience doing this work at home, but what made you want to go into the healthcare field? Because I personally could never picture it for myself, and I always wonder, like, what is it that clicks for people in the healthcare field to be like, you know what, I'm gonna do this shit full time.
It was a passion. So when I grew up and I knew I wanted to be in service to people, like that was my first thing. Like I'm gonna do like some kind of medicine, something like physical rehab. Initially, I thought it'd be like physical therapy and rehabilitation and things like that. My father has always been, he had sickle cell anemia, SSI, and had been sick on and off my entire life. So I've seen him in the healthcare system. And then when he transitioned to living in Florida, I saw him deal with so much racism and just systemic bias and really, really just poor treatment that it made me want to become like a pain nurse. Like I wanted to work in public health and be a pain specialist. I wanted to work in like sickle cell clinics. That was my coming into school, was like, this is what I'm gonna do, right?
Yeah.
Somewhere along the way, it's my passion still stayed to servicing people, but it changed to women's health because I got the opportunity to train at a birthing center through my nursing program as my women's health and family rotation. So I was like, oh, cool. Like this is gonna be better than going to the hospital. It's a great experience. And then I went. And when I went, I thought I was gonna hate it. I'm not even gonna lie. I thought this was gonna be crazy. I thought these women were gonna be off the wall. And I'm very like even kilter in my personality. So I was like, I don't know if I'm gonna mix well. But I end up, Virgin Islands are everywhere. So I end up running into this girl from St. Thomas who was having her baby at the birthing center in Miami. And I was like, okay, cool. Like, and she was like, if you want to come to my birth, you can come. And I remember going to participate in her birth and that baby coming out, and I just bawled my eyes out. Like I was sold. Like you can't tell me I'm gonna do anything else after that. And then I was like, I'm going to to work labor and delivery. That's my love. I done ditched my father and gone completely left. I know, but he's very proud. And I ended up in the hospital, and a hospital setting on a high risk labor floor after a lot of effort, and I was really, really great at it. But I just found myself just arguing with providers all the time. And the short story is this white man who was a physician and me were arguing over a patient decision he was making. And he looked at me in the hallway and said, if you want to make the calls, you need to become a provider, basically. He was like, shut up. If you want to be in charge, be in charge. But he was like, shut up. And then I was like, bet. And like the next week I applied to midwifery school. That's literally how I ended up like transitioning.
I don't believe in coincidences. And everything happens the way it's supposed to. As much as I want to pop that motherfucker in the face, I'm grateful to that man being so brazen with you because
he was very.
He could suck salt though, wherever he did.
He could suck salt, but
no, I don't want him no more. No,
that's a prime example of everybody. Like there's a necessity in even like the assholes, right? Because how much longer would it have taken for you to take that step had he not played
probably
in your face?
Years. Really, years.
Yeah,
I probably would have just been starting my program now, honestly, because I had no intentions of moving that quickly. But I was like, bet, sir.
Watch this. So there's like, I'm grateful for him because had he not low-key tried to disrespect Brittany, because that's what he was doing, was trying to sun her. He was trying to sun her, but what he did was he, created a gem for our community. So thank you, disrespectful ass white man.
It was like, every time I thought I was where I was going to be, it like transitioned really quickly. But it just made me believe more and more that like you just have to walk your path in life and just trust your instincts, and things will unfold the way they're supposed to be. Like really just go with it.
Love it. So I think your Johnny is very fit into our conversation, because later on we're going to talk more about just like advocating for patients and how much advocating Black women especially have to do when we're navigating a healthcare field. But before we're going to kind of lean into that now. So this is a question for all of us. When you are navigating healthcare, just whether it is your reproductive healthcare or just going through the healthcare system when you're sick, like, what is that experience like for you as a Black woman? And what do you think people should know about what that feels like as Black women navigating those spaces?
I'll say this, like before I was a provider, I walked into spaces really just like afraid. You're like afraid to make too much ruckus because you don't want nobody to dub you one way or the other or dismiss your complaints. But you get a lot of dismissiveness. And as I've become a provider, I try to give everyone the benefit of the doubt, because now my knowledge is so much vaster than it was before. So when I navigate the healthcare field now, I'm navigating it from a different place of like education wise, and a level of privilege that most Black women won't have. So I usually walk into an office. I don't tell them what I do. I don't tell them anything. But now I've yet to walk into an office, an ER, or a hospital setting where I've had to be seen as a patient and not have to pull my education out on them. Like, so that means that like we're living in a very dangerous space. So I'm usually very on guard now, because I'm like, at some point I know I'm going to have to tell them, yeah, I hear you, but this is what I do for a living, in order to get what I'm looking for from some of the places that we get care.
Yeah. So I'm trying to find the words, because the simplest answer is I've experienced it all. I've experienced those scenarios where I'm being dismissed because I'm a Black woman, but I've also experienced scenarios where I've been treated the way I deserve to be treated as a patient. I'm prioritized in the way that every patient is supposed to be prioritized. So it's literally just up in the air depending on like where I go. I was hospitalized recently, and I have to say, I was treated the way I was supposed to be treated, from entering the ER up until I was discharged. My health, like I was taken seriously. I felt like the friggin' medical professionals believed me. Could it be because it was visible why I was there? Possibly. It could be because they could see why I was there, because 2 years prior I was hospitalized because I had injured myself at the gym and there was no visible evidence of why I was there. So I feel like they thought I was exaggerating the amount of pain I was in. So it was the weekend. Going to the ER on the weekend is the devil, I have to say. I think it might have been like a Saturday that I went in. I was in excruciating pain. And there was people in the waiting room like yelling at them, like, dude, this woman is in pain. Like, y'all need to do something for her, because they weren't really prioritizing me. It was crowded, I get it, but it took a long time for them to like get me into a bed and all this jazz. So I've experienced both ends of it, and it don't feel good. Like, it don't feel good to not be prioritized and taken seriously, and to feel like you're not believed. Especially because where I live, the hospital near me is essentially in like a downtown area. So it's the fancier part of town. And so you get a mixed bag of patients. You get, the downtowners who are this color, but then you also get inner city people who could be drug abusers. And there was a lady in the space right next to me in the ER, and she was screaming and she was going through a lot, and the nurses were all irritated by her because they're like, oh, she's a regular, she's a drug abuser, and I'm like, y'all are literally violating this lady's HIPAA. Like, why are y'all telling me that this lady is a drug addict? Like, it's not my business. Like, is her screaming disrupting me and my experience? Yes. Does that mean that I need to be told and given a reason? Like, she deserves the same level of care that I'm getting. Like, I'm sorry. Like, I get it. She's irritating, but why are you divulging to me her situation? Like, y'all are weird. So,
or what if this time she's being truthful?
Yeah,
like,
and that's what
you're assuming that this person is painstaking. And my favorite thing to tell nurses who talk like that is to tell them, like, and so what? And so what?
Because what if she is an addict but she's injured? Like,
exactly, and that's the point.
Yeah.
Even if she's an addict, okay, and she's here for payments, and so what?
So what?
What I gonna do you?
Exactly.
To help her? Nothing. Give her payments.
Yeah, my experience in Navigate, it's been in a perspective of a fat Black woman specifically, and I think that's also a interesting like line to navigate, because a lot of times our issues aren't taken seriously because the assumption is that if we lost weight, it would be, that's the fix, right? So you in pain, but it's because you're too heavy for your height or your size. You dislocated your knee, but if you just lose weight, it'll be like, it'll
be fine.
My experiences have been very, very dismissive, especially, younger experiences. I was very active as a child and in high school and in band and all of that stuff. So I would get injuries often, right? And obviously not negating that, like, yes, your weight does have a lot to do with like how you carry, like how your body can support you, especially if like you're not in shape and all of that stuff. But again, I was active, right? So I was getting injuries because I was an active like teenager and all that stuff. Yeah. And I started to develop back problems sometime in high school, and back problems have been like the defining part of like my healthcare system experience, right? And I remember being in so much pain all the time that like we repeatedly went to the doctor back home, to this like well-known chiropractor, and not a chiropractor, he was an orthopedist. And I will never forget that he did an x-ray and he came back and said that my back problems were probably the result of like constipation or something, right? And I remember just being like, you went to school for this? Like,
constipation.
So fucking bad.
That's so random.
So bad. I was like, I'm not going to get the fact that you're the doctor here, right? But I am in like severe physical pain and I know it's my back. And he was so nonchalant about it that I told myself in that moment, like, we're done exploring whatever this might be. I would rather deal with the pain than to sit in front of somebody who is going to like patronize me like this, right? And it wasn't until the back problems got more severe to the point where I was having trouble walking and like physically standing up, I went to another doctor, and it was a woman this time. It was a white woman, and she went through the entire process of like really exploring what could possibly be happening to me. And they did like other exams and stuff. And I think it how long did it take? I can't remember what it is she did that like revealed that the way my spine was shaped, it was like scoliosis, but almost like in the opposite direction. So it wasn't like if you look at a spine, it wasn't like that. It was like going forward, and then, but like it was this weird like shape that my spine have that ended up contributing to like me being able to like herniate disc in my spine really easily, right?
Oh, wow.
So I would do like band, or I would fall, or I would be like fucking around, and I could injure myself really easily because of how my spine, or something she explained to me. But she took the time, she explained it, and like she actually heard, and I remember that was the first time a doctor had like taken it seriously. And she at no point, obviously she took my weight when I came in, never discussed my weight, never talked about it. And I remember her saying like, oh, lots of people like herniate discs and have bulging discs and all of this problem. She's like, it happens all the time. You go bend over, you go hurt yourself. She's like, for you it's a little bit different, but whatever. She would just clear.
Yeah.
But even minus that experience, because of how dismissive doctors were growing up, my habit when I go through the healthcare system is to assume that no matter what's going on with me, I am going to get the question of, have you thought about losing weight?
Anytime I've had an experience where something was repeated and it finally got figured out, it was a lady doctor who literally took the time to dissect everything. Is it more common, or do you guys think it could be more common in like lady doctors? Or
in my experience, it has been. Any healthcare situation where I was dismissed, it was a male doctor. The rare instances where like I was listened to, it was a female doctor. And the instances where like I felt they were sitting there holding my hand telling me, we are going to figure this out, it was a Black woman.
I think the more adversity you experience in life, the more you can relate. The predominant thing about doctors is that the majority are white male. And we know like the elite of our society is the white male. They're not going to experience as much adversity and challenges throughout their program. So women are going to just have more empathy in general. And then you have a Black female doctor who's now defeated all the hurdles it is to exist in the medical field. Who's more likely to listen to you? The person who struggled to get where they are, or the person who's already who just walked through the door?
Yeah, because even when you talked about like this lady came in and took the time, I remember when Dylan was a baby, we went through a period where he experienced like constipation, but he was constipated because he refused to poop. It wasn't that he refused to poop because he was constipated. He became constipated because he didn't want to poop. So he became
sorry, but that's such. This man said no.
He refused. When I tell y'all, Dylan, we always knew he had to poop because he would go in the corner and tense up, and he would do whatever it took to not poop, and it caused constipation. And it took, and I'm gonna just call her name because shout out to Dr. Moore. Dr. Moore is who, for one, made us aware of that's what was going on. But the way she broke down how the constipation is working and happening is what was just so like, that lady was literally bent over the exam table with a pencil, drawing what his little intestines probably look like and drawing like fake little poop. She's like, so this is what inside his intestines probably look like. And doctor such and such gave you the right medicine, but he didn't give you enough of a dosage. So you need to triple the dosage. And we were like, because we came back after like so many visits and we like, dude, this medicine ain't working. And she's like, that's because he ain't getting enough of the medicine. And she was literally sitting there drawing poop for us. And I'm like, it took a lady doctor to go to those.
And sometimes I don't think that medical professionals, the ones who are I don't think they understand, like, if you don't take the time to explain this thing, if you don't take the time to express like this level of care, the problem is going to continue existing, and then I'll keep coming back because you're not actually you're not fixing the problem.
Exactly.
Because you want to get out of here quickly, or you feel like it's not really a problem, or however, because you know how many times I went to that initial orthopedist like on repeated visits, and it's almost like he was exasperated by the fact that like
you're back again,
coming back. But I'm like, but my back problem, like I am a teenager who is having severe back pain. That's not, and I don't have boobs. So that's not normal. Like it's not my boobs. It's not all these things. After she figured out the problem, and she did the same thing. Like the woman literally sit down, draw my spine. I wanted to go back to he with a drawing and just like smack this man with it and be like, it's not constipation, you dumb bitch. Like I was so angry and like frustrated that it took that long to get an answer. Like that's all I wanted. I just wanted to understand what's going on with my body. Like people deserve that.
Yeah.
And I think
it's hard.
Yeah. And you know, advocacy is so necessary in these medical spaces, because I wish your mom had done the mature version of what you wanted to do. Like go back and say, hey, guess what? My fucking daughter's not constipated. This doctor took the time, because I had an experience a couple years ago where I had to keep going to see my doctor for the same thing. But I think I came in the first time. She called me with some information. I came in for the visit. When I tell you, this lady just breezed through this appointment. She didn't even give me room to ask questions. She just came in, gave me the information, wrote a prescription, and dipped. And I was like, wait, hold up. So after the medicine she gave me didn't work, and I called back and I was like, hey, listen, I want another doctor. I called and I was very like respectful, but I'm like, I want another doctor. I need to be seen again. I do not want this lady. And I explained my experience. So the doctor I ended up getting was actually a Latino man, but he took the time to explain things to me, make things clear to me, give me the proper dosage and everything. And it's like, back to what Brittany said, is because I'm sure he's faced his level of adversities as a Latino man. in medicine, you know, so it was probably easier for him to take the time to empathize with me, to give me the information that I needed. You know what I mean? Like, it's just wild. And me, I advocated for myself. I was like, this lady did not even give me room to ask questions. Like, I made it very clear. I'm like, I don't know who this needs to be reported to, but I wasn't even given a chance to ask a question.
You know why I think my mom struggled with advocating for me though, and this is specific to home, right? My mom was also going through a system of that kind of like doctors who dismiss you. It's not that big of a problem. And I know that now because my mom recently went through like some healthcare problems, and the first thing she did was go to our family physician, who's been our primary care since I was a baby, right? And in my mother's eyes, that man could do no wrong. He's right about everything. He was, from what she explained to me about what she thought her problem was, he was super dismissive. And to her, it was fine. And I'm like, damn, you used to receiving a level of care because this has been your primary care physician for decades. So I'm not surprised that she didn't push back harder because she's so like, that's the level
that's what she knew
of care that she's used to and has been used to for decades. So yeah, like I'm not surprised.
You have to also understand that like that our generations, like that generation comes from a generation that was taught not to make no trouble, because the generation before them was making all the trouble. Okay. So they were taught like, we did all this work, you need to slide through and just climb your way up the ladder and be grateful. Our generation came into the picture like, you ain't gonna treat, we done started going to therapy. We decided all these other things. You're not going to treat me poorly.
You're not going to talk crazy in my face. You're not going to act crazy with me.
Yeah. And I'm entitled to be good care.
Yeah. And the thing is they also just didn't know. They didn't have access to knowing that they deserve advocacy. And also because we have to recognize, like, they were trained, like you said, not to make noise. This is the doctor. The doctor knows what they're talking about. Who am I to question anything? You know? So I get that.
It's a very different approach to health and your body and your wellness as a whole. I think, and you also have to say the older physicians and nurse practitioners, whoever, providers, because it's a very broad term to cover everyone. The older providers were trained to make decisions for their patients. Literally, they were trained to diagnose, prescribe, and that's it. This is what I think is best for you. This is what you can. But coming into when I started my program, and at the last maybe 10 years is when they've started to say that you need to do patient-centered healthcare, meaning like I need to base my treatments not on what I feel like is best for you, but what you feel like is best for you. It's like getting a diabetic patient and them telling you, I don't plan on changing my diet. So please don't adjust my insulin for somebody that's on a diabetic diet. I need insulin coverage for somebody who eat what I want. Like you have to treat people.
It needs to be more collaborative.
It needs to be collaborative. Like you can't tell somebody this is what's wrong with you without being like pushing for more information. You know how many women I've had come into my office and been told by somebody they have PCOS and have no idea what that even means. Don't understand. And all they feel like is, well, everyone tells me it's gonna be hard for me to have a baby. And I'm like, no, I said PCOS is completely different. Some people who have PCOS have no infertility issues. Some people who have PCOS we have insulin resistance, which has nothing to do with fertility. Your fertility is fine. Like and some will grow hair and some won't grow hair. It's a very broad diagnosis of things. And when you start talking to them and you sit down and you explain it to them, they're like, oh wow, I had no idea. I had no idea this impacted my body that way. I had no idea that this is what it was. And they're like, here I am thinking I can't have a baby, and it has nothing to do necessarily with that. But you don't realize like how much of a disservice you do to people not really taking the time to educate them. And I will say that providers are stretched thin across the globe because there's not enough time in a day to treat every patient that you're supposed to be treating. Like there just isn't. Like there are patients I should sit in the office with for about an hour, like to really talk and educate them. But all you've been slotted was, 20-minute. I do 20-minute appointments because I just can't justify anything less than that. But a 20-minute appointment, and that appointment can easily become 40 minutes because you need to take more time. But we don't have enough time. We don't have, and it's hard. So you have to become really good as a patient and being able to say, okay, like I know I have this amount of time, but I need to know X, Y, and Z before I walk out of this room. You know what I mean? And really, and advocacy is something that is easier for some people than it is others, because some of us have people pleasing trauma. Some of us have poor experiences. Like, hey, like she's coming in the door thinking, I know there's gonna be shitty afterwards. You know what I mean? So like you're battling all of these things, and a lot of times, like when you go into something on your own, you're already, there's a doctor, there's an assistant, there's somebody else walking around, you're like fumbling through just trying to catch yourself, and by the time you look up, they're done gone. You know?
Yeah, that is it. Kind of going left a little bit because I'm going to speak specifically about like dental health care, but it's your body, so it's the same thing. I
never understood
how people are separate.
Why they're separate. I don't understand it.
I don't either. So over the last 3 years, because it started during the pandemic, I've had a lot of different dental procedures, right? Like major procedures done with like my teeth and my gums and all of that stuff. And one of the procedures was something that had to be done. It was several procedures over the course of several months to fix one problem, right? And the doctor who I was working with, well, he was a oh my God, I can't remember the formal name, but he was a specialist that would come into my dentist's office to do this work. And you could tell he's very, he's like very analytical, I guess. Like he's not like a emotional he's not the empathy.
You ever watched The Good Doctor?
It was very much that. It was very much like, I'm gonna tell you what's going on, we're doing it, open your mouth. Like it was very much like that. So I had my first procedure and I came back. And one thing that kept standing out to me from this was like, they explained kind of what was going to happen from the get-go, but it's almost as if they forgot that like, you're doing this thing over the course of several months. And like, I need you to kind of explain what's going on along the way, because this is like, it was painful. It was traumatizing. I was awake for all of it. Like all of this stuff is happening, right? You are inducing trauma on my body, right? And I think you should, at least before you start procedures, take time to explain what you're about to do. So I had come in for like the second procedure or something, and nobody in the course of setting an appointment, in the course of prepping me for it, taking me to the back, nobody stopped to say, this is what's going to happen today. He come in the room, said, you ready? I was like, I guess. No. And again,
no,
I didn't know what to do. So I didn't say anything. I was like, okay, I guess. Numb me, everything. I start doing this whole other procedure. And it was uncomfortable. It was very painful. And after the procedure ended, they took me to another room to do like measurements of my mouth for like the next step of it, right? So it was a dental assistant who was taking over for this part. And I had been in a room by myself and I had started to cry because I was just like, what just happened to me?
What just happened? Yeah.
I came in thinking it was going to be like a routine check-in thing. And this man just performed surgery on my mouth. Like, what just happened to me?
Oh my God.
And I was crying, and she come in and she was like, are you okay? And I was like, nobody's explaining to me what is going on. Like nobody walking me through the process. And for the minute I said that, she dropped everything. She bring my actual dentist into the room. They sat down with me. They explained like, okay, this is what's happening. This is going to be the next thing after that. And like they were apologetic about it. But I was like, dude, you can't.
Why did they have
people in here?
Right. Like, why did you have to get to that point
have
for
a
them?
breakdown?
It sounds like assault. Like they just decided what to do with your body.
It felt like assault.
It is assault. And I tell people all the time, you can be assaulted in a medical setting. If someone touches you, like I train midwife students, right? So it's one of my passions. I really enjoy having students come down. And at this point, I've advocated really largely in like the Black maternal health crisis diaspora that students have like sought me out to come and train with me. So they come and train with me here in the Virgin Islands. They spend like 6 months with me, and I've had like 5 so far. So I have another one coming. I have one that's leaving in 2 weeks. But one of my favorite things to teach them is do not touch someone without asking.
Yeah.
You ever have a doctor walk in the room and just touch you?
That's like crazy to me.
You don't stop touching people. And it is my largest pet peeve, because I said you are assaulting her. You do not have consent to touch this woman's body. I don't care what it is. I don't care if it's you just listening to their lungs. I don't care if you're touching their belly, their foot, their toe, you're doing a reflex. I don't care what it is. You say, hey, this is what I would like to do. Are you comfortable with me touching you? This is where I'm going to, and it's like people, and what you're doing is I'm training them to give the power back to their patient. Give it back to her, because when she walked into this room, she's lost it because everyone has trained her to let it go because you know what you're doing and you're the provider. But you need to change it with healthcare. We have to change the power dynamics because you're going to continue to miss things and ignore things, and people are going to continue to die because of it. The assault thing is like a really big touchy subject because in birth and in it is happening so much that like women will get a vaginal exam without consenting to letting someone inside of their vagina, or they'll get an emergency C-section and no one consented them to through this process or even explain to them what's happening. So there's this great amount of trauma. And there was some article, about a woman who sued her physician who in labor did a checked her cervix without her consent and did it a couple of times, and she felt like she was sexually assaulted, and it was a big uproar because the obstetrical community and some of the doctors are like, oh, it was an emergency and it was quick, and my response was, it takes 10 seconds.
Well, 10
seconds to say,
10 seconds.
I'm really concerned with your baby's heart rate. I need to check to see if your cervix is opening up. Can I check you? And it is her right to say no. And if she says no, then you need to pivot your plan based on that, because people have a right to consent to their bodies.
Anytime somebody is in a healthcare setting, a doctor's office, a hospital, like, they're not the most warm places on earth, right? No matter how you try to make them warm and comfortable, it is an uncomfortable process to be somewhere with somebody putting a needle in your mouth or doing anything to your body. Even if the OBGYN off, I don't like going there.
Oh, like, it's a lot. It's an
uncomfortable experience, even if you have the best provider. What is something that you think women just like don't know about their reproductive health or about themselves that you feel like we should know?
Period pain is not normal. That is the number one thing that we are programmed to believe, that like if your cycle is severely painful and you having to call to walk and you can't function on your day-to-day life, that's not normal.
Okay.
You deserve a better quality of life. You should not be managing that. And then I think my second biggest thing would be like vaginal discharge and odor is normal. There are just different degrees of what that normal is for everybody.
Yeah.
And this new, like, I don't know if it's new, I don't know what's going on, but this whole obsession with like
smelling like water.
Smells like water is driving me absolutely insane.
It's crazy to me. I'm like, girl, you have a smell. Like, what are you
like? People have a scent.
What water smell? Please, anyway, please be serious.
I swear, I promise you, those are my two like top tier things.
Well, for one, I know a lot of people experience like severe period pain. For most of my life, between my first period and like when I had Dylan, I never experienced cramps or anything. Unless I had my period marked in the calendar, I would find out I got my period because it just showed up. I never got like symptoms and stuff. And so I remember like when I was, very pregnant and my midwife was preparing me for labor, and she said, you're going to know you're in labor because you'll feel severe period cramps. And I was like, I don't know what period cramps feel like. Yeah, I was like, I don't. And she was like, well, fuck you.
And for me and my sisters, it's like the opposite end of the spectrum. Like, we're used to those periods that have you like throwing up, nausea, on all fours, like out of commission for days.
Shauna too. Shauna was saying the same thing, that her periods were insane. Now, after I had Dylan, I started to have symptoms, but still not severe. And between like when he was a baby and now, I don't get symptoms with every cycle. Some cycles I get symptoms and then others I don't. I feel like in the last few months I haven't really experienced any. So I don't know if like,
but what I want you to
is
think about is lifestyle. So look how much your lifestyle has shifted. And it's not a weight thing. And that's something I always tell people, like we have so much fat phobia in healthcare. Fat, the only thing, like fat holds on to estrogen, but all that does is increases, it's like the cycle of it increases your appetite. Estrogen is something, it just makes you more hungry more often. So they tell you lose weight, but my fat is making me hungry. And this is we already done our bad road. But the truth is that a lot of like high inflammatory diets, high inflammatory lifestyles, like high stress lifestyles, your cortisol levels are higher, and that increases inflammation in your body, which your uterus is a muscle, so it becomes inflamed when you're stressed out. It becomes inflamed when your joints hurt. And that leads to a lot of times more menstrual pain, more menstrual cramping, and things like that. So, like, an active lifestyle doesn't mean like I work out in the gym 6 days a week all the time. An active lifestyle means I move my body in a way that makes me happy. So, like taking the time to do things to decrease your stress, like stretching or Pilates or some light yoga or dancing or something that bring down those levels will help decrease your period pains. But a lot of times, if your period pain is not adjusting to your lifestyle changes, then it means that something is going on that is not normal. Like that nausea and vomiting and severe pain through your cycle sounds like adenomyosis or endometriitis and all these things, which are really, really prevalent in people of color, but you're ignored because they say, oh, it's just period pain. It wasn't until I was like halfway through midwifery, like I met my first midwife when I was 21, and I went to a clinic because I was poor. I was broke. I had no real insurance. I was in college and I needed to go. So I went to a public health clinic, and she was like, "Oh, honey," I was like, "My period is 9 days and it comes every 24." And she was like, "You're on a period every 2.5 weeks." She was like, "What is going on?" She's like, "That's not normal." And I was like,
"Wow, that's
I
just
thought this was
why I used to, yeah."
Yeah, I just thought this was normal. She was like, no, we need to reset your hormones. We need to test you for other conditions or whatever. And mind you, she was like the fourth person I had seen because I was going to going every year for my annuals.
Yeah.
So it wasn't new to me to tell people about it. She was just the first person to tell me it wasn't normal.
Yeah. Oh, I hope this episode reached so many women, especially Black women. I hope y'all are in a position. I hope y'all have the proper insurance to go straight to your provider and be like, let's reset my hormones, babe. Because, and even I want to reference the anti-inflammatory diet, because even when you were describing everything, and I'm thinking about the short period of my life where I did have period symptoms, my diet was not the best. It contained a lot of foods that cause inflammation. I've always been active. I've never been a sedentary person, but I was in constant states of stress. I was in an abusive relationship. Like I had so many things going on that even though I was taking good care of my body, there were things counteracting it. So it's kind of like washing your car, but you kind of washing it with mud a little bit, or like it was like you're doing the right things, but there are things that are getting in the way of what you're doing. So I'm glad you brought that up.
I kind of want to focus too on maternal health, because that's the other part of shit we don't know, right? Like we don't know a lot about our own bodies, which makes it even worse when we become pregnant and then we're carrying this human. And I feel extra passionate about this because my sister just had a child and recounted her experience with like childbirth and all of the things she did not know and that nobody explained to her. So yeah, if Ayo could touch on that, because we have a midwife here and we have somebody who brought a whole ass human into the wall. So like, what are the things that you wish somebody had told you, or that you wish people knew about maternal health and about having babies?
I think I think what I would want people to realize is that maternal, like everyone hears about this maternal like health crisis in America and across the globe and things like that. But mainly in America, they look at it and be like, oh, what can we do? What can we do? But our maternal health crisis is directly linked to like racism. Like the Black maternal health crisis is directly linked to racism and systemic bias, and it doesn't necessarily mean that you're in better odds of getting when you get a Black provider, is the crazy, scary part as well. So it really is more linked towards like where you deliver. So what I would tell people is, if you're a pregnant person who's going to birth your baby somewhere, you need to treat this thing like you would when you're buying a brand new Mercedes Benz. Like you need to talk to people. You need to look up the stats for the car. You need to, so if you go on Google and you see that the dealership have bad reviews and it sells bad cars, you're not going to buy a car from them. You're going to go to the one with the great reviews. And the thing, March of Dimes, if you go onto the March of Dimes website, literally publishes the hospital's C-section rates across America and major urban areas. If your first research should be, what is the hospital in my area with the lowest C-section rate? Because they're going to be providing better care, right? Because they're gonna actually most likely have less interventions, have more of a supportive floor, have more and better outcomes. When you look at a hospital, there's hospitals in the States that have like 40% primary, which is your first C-section, 40% C-section rates, and people are going to deliver at those facilities because they're pretty, right? They look good, but you're gonna get atrocious care at those facilities because it's just not gonna happen. And I think that would be my first thing. And then my second thing is really take the time to choose your provider. Once you know where you're going to deliver, then choose a provider that matches you and your style and what you desire. And not just someone who's telling you what you want to hear, someone that truly supports your vision for your birth. If you have been seeing someone for care and they have not asked you, what is it that you're hoping for from your delivery? There's something missing there. They're not interested. You are just another number on their desk and you need to move on.
Yeah. I'm really glad you said that, Britt, because one, everybody knows that I'm one and done. But in those, I think maybe once a year, twice, if I'm feeling spicy, I have moments of being like, I could probably have one more baby. But then I think about the fact that the chances of me dying on a delivery table are high. And I'm like, no, I'm good. You know? Yeah. So what you just shared is helpful. And I hope there's like potential moms or just people in general who may one day deliver a baby or who are potentially preparing to deliver a baby. I hope you guys take that information and run with it. The thing that I wish, and this is just based on my experience as somebody who like gave birth, right? I wish that people knew that everybody's pregnancy and delivery and postpartum is different. My body is not doing the same thing. I mean, granted, it's the same process, right? But everybody's experience is different. The women in my immediate family have never had to have C-sections. My grandmother didn't have to have a C-section with any of her children. None of her daughters had to. We have mostly women in my family. When it came down to, okay, the doctors have decided that Deidre needs to have a C-section, everybody was freaking out. Like, that's not right. We've never had to have this. Like, none of us have had C-sections. And it's like, are any of y'all carrying this baby? Because he's not coming out. I was not progressing. And granted, my birth experience was very different than my family because they all, from what I understand, they all went into labor naturally. I was 10 days past my due date when they induced me, and they induced me because my midwife, I had a very good midwife. I adore her. I'm so grateful for her. She let me go as far as I could. She would have let me make it to 42 weeks if but she looked at that last ultrasound and she called the hospital and was like, y'all need to induce her. Like, this placenta is mature. This baby, like my estimated due date was very accurate, you know, because I'm a person who tracks my period. So the estimated due date they gave me made sense for my cycle. And my body just wouldn't go into labor at all. And so my sister, my mom, they were all freaking out because they're like, this labor process is taking forever. Like, why is she still in labor? Like, they induced me maybe like 8 a.m. on April 17th. 8 a.m. Dylan wasn't born until 10 p.m. the 18th of April. So I spent that whole time laboring. And even when they finally decided to give me to have a C-section, I had only, in that whole stretch of time, I only made it to 4 centimeters. Like, my body took forever to dilate. Like, and they had to induce me in steps. They started with, what is it called? Cytotec? They started with that. And then after like maybe 12 hours later, they moved on to Pitocin. And it was an aggressive procedure. And finally, my midwife and I were literally like crying together. She was holding my hand crying. She's like, Deidre, I wish we could do what you initially wanted, but we have to have a C-section at this point. Like, the baby's heart rate is going up and down. You have a fever. She was like, we can't keep this baby inside you. She was crying real tears. She was holding my hand like, we were bawling. She was on the phone outside crying to her husband. We were really emotional. It was really emotional. So for one, I just want people to understand, especially, you know, those, I know y'all mean well, but your daughter, her delivery gonna be a lot different than yours. Your sister, your niece, or they, them, whatever the pronouns are, the people in your life who are giving birth to babies, everybody's delivery, gestation, everything is gonna be different. So hold space for that. come into that space ready to support and to learn. And that's it, because, you know, it just is what it is.
It's very different. I think I take a really holistic approach to labor as well, which I realize like patients and their families aren't used to. So like they're like, why is this taking so long? Last time my dad had come in and had a baby, she, you know, they gave her the IV medication to make her contractions stronger, and the baby came out quicker and whatever. And I always tell people, like, I don't do anything to a laboring person unless it's medically necessary.
Yeah.
I'm going to let your body labor. I'm going to let your baby come and labor, especially for first labors. And, you know, you had a different circumstances. You started developing a fever, your baby had drops in its heart rate. And those are like more critical decision-making times where you have to figure out, like, does the risk outweigh the benefit of continuing this labor?
Yeah.
But a lot of times we end up with complications because people aren't patient. Like I've had a patient that was 6 centimeters the other day for 12 hours and birthed her baby 2 hours after that. But it's unheard of in the States. They would have sectioned her. They would have told her, you're not opening up, your cervix isn't opening up. We can only do this for so long. These are your risk factors. But really, it was just her first baby. Her body stalled out because her baby wasn't in the best position. She needed a little bit of time and some adjustment and some different position changes, and then she delivered perfectly fine a few hours later. So a lot of times you have to really have a provider that supports you, supports what you want, and really have a vision of what you want for your birth. It's scary. Like, you have to prepare for pregnancy and labor like you do the rest of your life. There's doulas. Doulas are a great support system. Every person who has a baby should have a doula, because they're trained to help support you through your labor, through your postpartum, through your pregnancy. Every person who births should really start doing the research, so you know the questions you should ask. You have information. There's a free research called I had just looked it up. It's called Just Birth Space. It's great. It's for patients. It's free. They do free virtual birth education classes. They do free maternal yoga. They do free childbirth prep classes, postpartum classes, baby parenting classes, and it's all free. And the recordings are all available for people. Like, really prepare for this thing, because your body and your experience is going to be very individualized. And then the second thing is that, like, when you're coming into a space where you're going to be like laboring and birthing and be pregnant, like, it's different. And I think Deidre touched on something that's really important. Tell people to stop telling you their story. If your story is traumatic, don't share your story with me, because I don't want to be scared all the time because you've had this horrible experience.
I'm so glad you said that, because for the life of me, if I meet somebody who is getting ready to have their first baby, I would never find that to be an appropriate time to share my birthing experience. Why would I do that? Like,
let me tell you, like, that's the worst idea. Like, girl, let me tell you about this. I had a fever, girl. My baby's heartbeat was dropping. I had an emergency C-section at 12 o'clock at night.
You know what I do like to share? I like to share how to utilize that laboring process. And I like to give advice on, listen, make sure you have people in the room who are going to actually support you. Because one thing, Diamond and Dylan's dad, they took turns, because I had labor in my back. So they would take turns. My midwife had showed them to press against my back with the contraction. So she was like, whenever she's having a contraction, y'all need to press firmly on her lower back. And only Diamond and Dylan's dad got it right. Like, anybody else who would try, aside from my midwife, I would get irritated. So those are the things I share with expecting mothers who ask, because I don't believe in giving expecting mothers unsolicited advice. But when they ask those questions, I'm like, listen, my midwife let me eat while I was laboring. She let me have like light snacks and stuff. I know some providers are like, no. Mine let me eat. Diamond made my room so ambient. Like, Diamond created a playlist for my laboring process. Okay. Diamond and Dylan's dad took turns keeping me company. It was just such a beautiful experience. It's fun. And those are the things I share. I'm not going to share how things went left and that baby was like, no,
this is what my body did.
I'm going to say.
And I was, me and my midwife were just sobbing out of tears. Like, that's what people want. But a lot of times people share these horrific experiences. And I tell people all the time, like, and my favorite thing to tell a patient is there's two people that want to be in your birth room. Somebody who wants to meet the baby and somebody who wants to support you. The person who wants to meet the baby is not who you need in your labor room. You want the person who is there because they're concerned about you and your well-being, and they could care less about our baby. That's who you want in your labor room.
And I'm gonna tell you, right? Let me tell you, if you are having a baby with a partner who, you know, because I've talked about how abusive Dylan's dad has been toward me, but I believe that he is just maybe a troubled individual, because I don't doubt that he loved me. I had to forcibly yell at that man and say, follow my baby, because my birth eventually ended in a C-section. He was checking in on me. He was really good in that regard. They took my baby up out of my uterus. They took him to the other side of the room. One of the nurses had to yell at the person and be like, yo, bring this baby to see its mother. Like, are you... So they bring me my baby. They about to take that little motherfucker to like wherever they take the babies. And I'm like, go follow the baby. And he's like, no, I need to stay here with you to make sure you're okay. I was like, go follow my baby.
I need eyes on my child. Yeah.
Yes, I said I will be fine. Because you know why? Like the nurses who were taking care of me, Dr. Berkeley was there. I was like, I'm in good hands. Go with my baby. Oh, I love Dr. Berkeley. Oh my God.
Yeah. But it's still good that like that was the concern, because Brittany make a good point. Like a lot of people, when it comes to childbirth and labor, a lot of shit. My sister said this too after, because I recently saw her like a few months after she gave birth. And she's saying, you know, one thing that I wish people would understand is that after a person gives birth to this baby, I don't need you to come over here to help me with the baby. I just met this little motherfucker. I want to spend time with him. Like, this is my baby. She's like, I need you to come over to clean my bathroom. Like, I need you to come over to cook. I need you to come over to support me in this way. Don't come for the baby. I get a baby.
Yeah,
like,
that's crazy to me.
Westernized approach to childbirth and postpartum is the pits, okay?
Because they don't like women.
Listen, if you have a baby in Canada, right now, they will pay you like $6,000 just for having the baby, okay? Just for giving birth to the person. Literally, you get like a $6,000 check right off rip. You're out of work for the next year.
It's a whole year, yeah.
Pay. The entire year with pay. They're not gonna make you broke because you had the child. So they're gonna pay you for having a child and then pay you for not working after you have the child. When you have a baby in Europe, when you go home from the hospital, you go home with a nurse. A nurse comes home with you to help you take care of that baby for the first 24 hours. When they do a 24-hour check, they're there, and then they're there. Then the first 3 days you go home, and then once a week for like 2 months. And then after that, it's like once every 2 weeks to make sure this baby is fine for the next year of the child's life. You know what I mean? And then and it's consistent. Like, and in China, there's like you don't go home, you go to your family's house because your family's gonna take care of you.
And it's a cultural thing.
It's a cultural thing to take care of the woman who just delivered, because your body's in like such a delicate space. You're home. How you want me to take care of this? And don't be breastfeeding while you're doing all of this, you know. Please, because if you are breastfeeding on top of having to do everything else, you're feeding every 15 to 2 hours. So every time you turn around, something is back. It's something back on you, and they make people feel like this. You're just supposed to naturally be able to accomplish all the things in the world.
No,
I can't really take care of myself. Now I have to take care of somebody else and my entire house. It's unrealistic.
I'm glad you brought something up, Brittany, because it's something that a little question I had for you. Because I've learned and heard that in Eastern cultures, pregnant women and new mothers are revered. They're well cared for. They're well cared for. So I'm glad you came on here to confirm that. It's so funny. This morning I was on the train and there was an adorable pregnant lady, and you could tell she was commuting to work, and I was livid that a lady had to go to work. I was like, I can't believe we live in a place where somebody whose body is so vulnerable right now has to get her feet were swollen, and she was handling it well, but I'm like, she shouldn't have resting. She should not have to be on the train going to work at this hour. It was early in the morning too, and I was like, I think that's only like on this side of the world. Like other places, like elders move in, aunties come and they help and they support the mom. But here we are, this nucleus, however you refer to a family, with just the dad, just the mom, and this mom is drowning because like you said, I barely know how to take care of myself. Now I have to take care of this whole other person. I cried in the car on the way from the hospital to my house when Dylan was a newborn.
Mm-hmm.
I was like, once I left the hospital and I no longer had access to like the nurses, I was bawling the entire car ride home because I was terrified. Mind you, I've raised my nieces and nephews. Like, I know how to care for a baby, but this is different. This baby just came out of my motherfucking body. Like, what the fuck? And
I'm still sore. I'm still trying to recover. I'm bleeding everywhere. Like, I'm not, it's just not,
it goes back to what we were talking about earlier, where like people see childbirth as this beautiful, wonderful thing because of the baby, but what they don't realize is the mother just went through something traumatic.
So much.
Like,
and while
it's trauma.
No. Now that I will say is not. I will not call childbirth trauma. It is the most primal experience someone will ever have. It is the most naturally built thing that your body is equipped to do than anything else. And I will say the one thing, like, we look at childbirth and we say that like we've gotten so medicalized that like all of our interventions have made childbirth safer. But in actuality, it is more dangerous now to birth because of the level of interventions than it was prior, right? So in other countries who aren't as medicalized as us have better birth outcomes for mom and baby than our modernized American healthcare system, right? So we have to look at it this way. Birth is not traumatic. Our bodies are birth is one of the most beautiful experiences when you have a supportive team, when you have a supportive midwife, when you really are encompassed in that experience, you will walk out of that place feeling so empowered and so strong. Like, you'd be like, bitch, you can't tell me nothing. Like,
listen,
I've had patients come to the office who have started the pregnancy, like, won't say nothing, was very meek, very quiet. And by the time they finish their delivery, they'd be like, you can't tell me nothing. You can't tell me. They'd be like, you can't
I just push out the whole human. Like,
correct. And you know,
like, you can't.
I'm glad you said that, because even though I didn't get to push Dylan, that's my attitude, right? And that's how come I'd be saying, like, I want to see women stop letting these men playing in their face, because until your body could turn liquid into an entire human, and then you could let a motherfucker out of your body, watch your mouth when you're talking to me.
And whether it's C-section or giving birth natural, because C-sections, like,
it's the devil. The recovery was terrible. And I'm glad you said that it's primal, Brittany, because so that's the other thing I would say is I didn't prepare myself for a C-section. It never occurred to me. Listen, I spent majority of my pregnancy reading up on things, learning things, watching documentaries. I was so ready. I actually went in, my birth plan was to have a natural birth. I had no intent. I was like, my ancestors was able to have fucking babies without epidurals. Like, bitch, I'm finna deliver this motherfucking baby. Like, I was prepared. I mentally prepared. And that's probably why my labor, like, the pain, everybody in my like room, especially like my mom and them, they were freaked out because they're like, that needle on that NST is way at the top and you just over here deep breathing, like, you're not losing your shit. And I don't know if maybe I don't know if maybe I mentally prepared myself for more pain than I was experiencing, or if I have a high tolerance for pain. Don't know, don't care. But what I do know is that the one thing that I wish I had done differently was prepared myself for all possibilities, because I went in just thinking that I was gonna labor, push this baby, and leave like, you know, glowing. And
one of my biggest things I would have said, the one thing I would say for you, just in hearing your experience on my end and receiving that, is that I feel like your provider didn't do a good job of preparing you for how long that process would have been. Because inductions are not 24, 48 hours things. Inductions are 3 and 4 days. Because we're forcing your body to do something that it wasn't supposed to do. So a lot of times where things went awry is that, you know, I always call them dramatic babies. Like, you had a dramatic baby. He wanted to make an entrance. He wanted to spice things up a little bit. And in
my
those circumstances, you have that. Yeah, just a little
and he was born on Good Friday. So.
Yeah, he had to declare himself. So I tell people a lot of times, and that's one of the things I say, preparing for the outcomes. And every patient I have, even if they're like, I want a vaginal birth, I want blah blah blah, we have a brief conversation about, in the event of an emergency, I'm never gonna blindside a patient. I'm not gonna walk in and be like, you need a surgery right now. Like, we're gonna talk about things as they come up. We'll talk about concerns, whatever, as they come up.
Yeah.
So that way, if something does happen, you would have known in ample time that this is what we potentially are looking at.
Yeah.
And this is why. I think that, like, you have to prepare for all outcomes. I think that outside of a brief conversation, like in the event of an emergency, this is how this is managed. I really wouldn't have said prepare. You can't emotionally prepare for an OR. Like, there's nothing you could have done to prepare for that OR table. So don't even take that on. You know what I mean?
Yeah, you're right.
It is the most isolating feeling to have a C-section. Like, you are literally completely detached from the other part of your body. You don't see, all you feel is people pushing on your body, and then like people walking around and everyone talking, and
it was really uncomfortable. And you use the right language. It was isolating.
It was isolating.
And I'm so grateful for my anesthesiologist, because he had his bedside manner was impeccable. He created a sense of comfort and warmth for me, because I mean, obviously he knows ORs, you know, so but you're right. There's no way I could have prepared. I think I just wish I mentally prepared myself for that possibility, because it never occurred to me that my birth could end in a C-section. And that's okay.
I think maybe that's the part of birth that like I interpreted as trauma. It's not like the birth itself, right? Like, I agree that like we were built to do that shit, right? But in hearing my friends' experiences going through the birth, a lot of them have had those experiences where, unlike like your approach to it, Brittany, like everything is, we doing this now. They don't walk in, you have to have a C-section. They don't walk in, we need to examine you. Like, a lot of how American doctors handle the birth process feels like it would be traumatic, because it's like, you ain't letting my body do what it's supposed to do, and you insisting I have to do all of these things, and you're not explaining to me any part of the process.
So what you're saying is that the care received created traumatic experiences,
right?
But birth within itself, like, the staple for every other culture who has leading like health outcomes for women is they push midwifery care as their primary model of care. Their healthcare, their obstetrical stuff is ran and it's midwife-led policies and best practice-led guidelines and things like that. Whereas here, they're like, a lot of providers don't update their practice ever across their lifespans. They don't do anything but a medical model of care. But if you are looking for something to be wrong at every turn, you will find something to be wrong. Like, you have to like check all your boxes, make sure everybody's fine, and then allow the birth and the process to happen naturally. But a lot of time in the model of care that they're pushing for obstetrical and women who are birthing or people who are birthing is that like, we have to do something to make this happen. And if it's happening, we need to do something to make it happen faster, because no one has the patience to let labor just occur. All of the studies that you have out right now show that there's like this labor curve, but the labor curve existed and was done 50, almost 50 years ago, I want to say. And that study is false. It's out of the question now, because 50 years ago, we was also walking miles a day for water up the street. Like, we don't live that lifestyle no more. We're not, the average woman is not 18 and birthing. You know what I mean? Like, a lot of now, like a lot of our patients are over 30. They're waiting to have kids. They have more health problems. There's other things going on. So if you're using a labor curve for a completely different generation of people, and you're expecting this to be valid, whereas with midwifery care, it literally says, unless something is going on that the mother of the baby has shown signs of like potential distress, we don't do nothing. You're not going to do nothing. You can't check back. I'm not going to do much to you. And I induce patients. I have high-risk patients. I have whatever, but I've also been able to maintain that like my C-section rate is less than 10% because I don't interfere with people's bodies unless I need to. And there's times I have patients who've had C-sections that I've battled on the place with them. I have patients I've had to send off island, and I'm anxious. When I tell you scared, that'll be like, call me, tell me what's going on, let me know what's up. And I really like, and you push people, you push education, but at the end of the day, the providers have to do better. But because our providers aren't doing better, we have to equip ourselves with the necessary things. What that looks like is a supportive partner. And know your partner. Not every partner and not every man, woman, thing, person that has gotten you pregnant is capable of being supportive. Know your partner's strength. Know if they cannot handle that. If you have the financial means to get a doula, get a doula. If you don't have a financial means to get a doula, screw the screw the baby shower. Ask people to donate to your doula for your pregnancy and your postpartum care. Like really step up and take control of what's happening to you. Bring somebody with you to your prenatal appointment. Write down your questions. So be like, I'm 20 weeks. What do I need to be looking for? Like, know that you are entitled to the time that is necessary for someone to talk to you about what's going on with you. Pregnancy is a honored and respected, and you are making eyeballs, for God's sakes. Like you literally, so take the time to prepare for these experiences. Childbirth is more dangerous than like birth control as well. So like people be like, I don't want to take birth control because of the side effects and blah, blah, blah. You could die if you get pregnant. You could die literally 6 weeks into your pregnancy. You know what I mean? Like, and I'm like, I stress to people like, unintentional pregnancy is life-threatening. Like it is a life-threatening state. You need to decide on like whether you want to do and like birth control. And if you live in the mainland, I'm telling you right now, get on Amazon and order your Plan B then, because it's $15 on Amazon to order a Plan B over the counter. It is cheap. The generic Plan B is $15 on Amazon. Pop you a couple of them and keep them in your car. If you don't want to be on sustained, like, you know what? You don't want to be on sustained birth control. And then talking about like different options, I feel like I was on another podcast and I love them, another local group, and I said something that I feel like is really important. When you walk into a provider's office and you get a diagnosis, one of the best ways to force them to teach you is to ask them, if I don't do this, what are the potential risks and what are the potential outcomes? And the next question is, if it's not this, what else do you think it could be? Because what it's going to do is force them to walk through their thought process with you. And it's the easiest, because then they're going to be like, okay, well, let me go through why I feel like it's this. Let me go through, if it's not this, this is what I'm thinking comes next. Because a lot of times you'll hear like, oh, well, it's constipation. And if your mother has said, well, no, if it's not constipation, what do you think it is?
Yes. Like, what if I take a shit this morning?
Correct. Exactly.
Correct.
Exactly. Those are really good questions. Those are really good questions, because not, you know, it's like not every doctor is going to be thorough, you know, like, so that's going to force them to be thorough.
Thank you so much to Brittany for coming on. I have learned so much, and I think the audience is going to learn so much. And even if I don't feel like fully educated on the things you need to know, I feel like we've opened the floor for Aya to start asking more questions of your providers, for you to start advocating for yourselves a little more. And I'm going to be honest, for people who might be hesitating to have kids, it kind of alleviated some fears about like the birthing process. Cause I'm like, okay, it don't have to be like that. I could make sure it's not by doing my research. So dying me promising I that child. I don't know. But I feel better about it, at least a little bit. So thank you so much, Brittany, for coming on. We appreciate you. I will link all the things, because I also really enjoy Brittany's TikTok. And I don't learn so much about it.
That ass. Like, your TikTok is such a resource, Brittany. It is such a resource.
Yeah. I think my TikTok matches my personality. Like, it's all things. You can get a little hot girl. You can get a little education. You can get a little bit of ratchet. Like, it's a little touch base. I just feel like before we close that, I want to say both of you guys have agreed to come birth in St. Croix with me. So I would just love to say that by the end of this conversation. So we're going to have a docu-series of the good up labor process.
Oh, imagine. That would be so
fun. Of the pregnancy and, you know, contact. Okay, so we're going to end up meeting, you know, lots of imaging, lots of contacts, very, very big picture.
Oh my God.
We're going to have to set up all the cameras.
I need to decide on the timeline for the pregnancy first, because I'm like, I know it now. Right?
But you have time. My mentor dropped her first baby at 41.
Oh, I like your mentor.
No problem, no health issues, no nothing. She had a beautiful pregnancy, beautiful delivery.
Because I'm adamant, like, I don't want to work when I'm pregnant. I want to be off for all 10 months of my pregnancy. I want to give birth where I want to give birth. Like, I want it to be, obviously, like Deidre said, you can't predict what's going to happen. But for as much as I can control, that's what I'm going to control. Because I'm like, no, I want Paula Rihanna. I want my child to be born in St. Croix. If I could help it, like I want to be on the beach with my big belly and then be like, oh shit, I got you know. Anyway, So again,
wait, Rihanna had her second show.
I don't know if she had them yet, but she has been like making regular.
She's in Barbados.
Yeah, she's in Barbados. So I love that for her. I'm like, yeah, you make that child Bajan, you smart. But yeah, to the people who are listening, you know where to find us on social media at Good Up Pod, and I actually want to hear some of y'all like stories with like navigating the healthcare system. I obviously don't want to hear your scary birthing stories, Brittany. Don't tell her I don't come in here trying to scare me. But if you had wonderful birthing experiences, I would like to hear those. And yeah, we will be right back here next week. If you want to see the full video of this episode and get bonus content, all that stuff, join us over in the VIP section, because Brittany got this like nice ass red shirt. It complementing a tan she just gained. Like she looks fucking good. Okay.
Yeah, Brittany one thing Brittany gonna do is look good.
And if you're on Patreon, you gonna only see little bits and pieces on social media. You gonna see Brittany for real. So you need to join the Patreon and then see Brittany. Okay. So with that being said, Deidre, you know the drill. Tell the people bye. Bye. This season of the Good Up Podcast is sponsored by Empath Psychological Services. The Good Up Podcast is Black woman hosted and produced by Deidre Ritter and Heiza Quinones Ivory. Find us on all social media platforms at Good Up Pod. Tag us using the hashtag Good Up Tuesday and join the VIP section over on Patreon for exclusive bonus content at patreon.com/GoodUpPodcast.